The paper really is a bid to the sex robot industry to tap into this, what I consider to be a new and growing market, because societies are aging and people are living longer than ever before. And alongside that is chronic disease and disabilities that impair sexual functioning. So today's sex robot industry is, sexist, ageist, heterosexist, ableist, and really there are opportunities that have been unexplored. The idea of robots as companions for older adults, I think, is considered unseemly and unthinkable. We're fine with robots for younger, able-bodied men, but the idea of manufacturing and designing robots for older people, especially older women with disabilities, for example, is a demographic we really haven't marketed to. The attitude of society, the attitude of Western culture toward sexuality in later life is really glaringly ageist. So older adults who express a desire for sex are, ridiculed. Older adults are thought of as asexual or beyond sex, or if they show an interest in sex, they're considered dirty. So it's really not encouraged and it's not supported. In the healthcare setting, primary care physicians rarely ask about sexual functioning, sexual health with their older patients, even though this age group, 65 and over, is disproportionately affected by impairments in sexual functioning. A lot of ethicists defend sex robots by appealing to utilitarian arguments. They say these robots are great, they'll be a source of pleasure. But I think that argument really misses the boat. Sex, I believe, is about something much deeper, or it can be. It has to do with our identity. It has to do with some of the central things that we can do and be as human beings, like affiliate with others, have bodily integrity, be healthy, form relationships. And I think the dignity-based argument really runs deeper and gives a reason for society to have responsibilities and step in and help. The current COVID-19 pandemic is really forcing the issue, because all of us, especially older adults, are very socially isolated and lonely because of physical distancing requirements, and not seeing people in the office if we're working at home, not seeing our neighbors and our friends. So I think we're thinking more about it, and I think robots are also getting better. So they're becoming more emotionally intelligent. They can read our nonverbal cues and relate to us and engage in conversations. It's easier to have a robot companion because they just make better companions. I think there are definitely societal changes occurring in the West and across the world, really changing roles for women as countries develop. Women have higher levels of education and they have opportunities to pursue careers outside the home. And so they're just not available to take care for free of their aging parents and grandparents. As well, there are people are living longer, so they need care for a longer period of time, and there's less care available on an informal basis from family members. The journal article does three things. The first thing it does is it dispels ageism, which is negative stereotyping about sex in later life. Second, it gives an argument. And the argument is that society should step in and help older people, especially those with disabilities, to improve and maintain their sexual function by using technologies, including sex robots. And third, I reply to objections. And these really, run the gamut from those who argue that sex robots, we should be having sex with robots at all, or that certainly older adults shouldn't be doing that, or that it's deceitful, that we can't really have a good relationship with a robot because they don't care about us.